Assalamualaikum, my name is Atika Hazar binti Anwar. Today, me and my team are going to be talking about burn injury first aid. So, what is first aid and what is its importance? First aid is an important tool in quickly responding to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical professional arrives to administer more specialized treatments. Aims for first aid is 3P. The first P is for preserve life, which include the life of casualty, bystander, and rescuer. The second P is for prevent worsening, and the third P is for promote recovery. Four main steps of first aid. Step 1. Assess the situation. Assess the situation and check for any potential danger for yourself, the patients, or the bystanders. Check for safety before rushing to the injured patient. Make sure the situation is safe for you. If the situation is too dangerous, stay back and wait for professional care. Assess the person's condition and assess for injuries, signs of shock, or psychological trauma. Step 2. Plan for intervention. Get help by call for help or ask someone else to call for help. Plan first aid interventions by plan what action to take until professional help arrives. Determine how much help you can give based on what you know and what skills you have. Ensure your ongoing safety as a rescuer. Step 3 is implement first aid. Give first aid for life-threatening emergencies and specific injuries based on the initial assessment. If emergency services are arriving very soon, do not spleen injuries. Step 4 or the last step is evaluate the situation. Check when the medical professional will be arriving. Check that the scene remains safe. Recheck the action after the initial assessment. Check that bandages are still in place and bleeding has been stopped. If the person becomes unconscious, follow action for basic life support. Hand over the person to medical or professional personnel when they arrive. Find out which hospital, clinic, or healthcare will provide care. Inform family and relatives.
Hi guys, I'm Karishma. I'm here to tell you how to identify the levels of burn. So as you all know, there are three types of levels of burn. The first degree burn, second degree burn and third degree burn. In the first degree burn, it affects the outermost layer of the skin where it causes pain, swelling and redness. The second degree burn where it affects the outermost layer and underlying layer of the skin where it causes pain, swelling, redness and even blisters. In the third degree burn, it affects the most deep skin of a person where it causes blackening of skin, whiteness of skin and even numbness to the skin. So burns falls in two different categories, the minor category and the major category. In the minor category, the first degree burn can happen anywhere on the body, whereas the second degree burn can happen like 5 to 7.5 centimeters wide. So moving on to the major category actually is the third degree burn of level, where it happens more than 5 to 7.5 centimeters wide and it happens on areas such as face, feet, hand, buttocks, groin and even joint point. So I'm here to tell you about the safety precautions and even the techniques. So when burns happen, please remove jewelry and clothing on the damaged area as it can promote to further damage and promote shock to the area. Run cold water on the wound so that it will cool your burning sensation. Other than that, if you have a broken blisters on the area, please do not run water on it so it won't cause any further damages or infections. So moving on, for full thickness burn, you should cover with clean cloth, clean sheet or even sterile non-adhesive bandages if possible. Do not break the blisters which has fluid inside where it will cause more damages to the skin or even irritation and infection. If possible, for burnt toes and fingers, use non-adhesive dressing materials. To reduce inflammation, elevate the body part above the level of heart. How to indicate shock? So there won't be any calmness in the hand or feet of the person. You'll see the weakness in the person, even increased pulse, rapid breathing, low blood pressure, and paleness on the face or on the skin. So what you can do at this moment, lay the person down, elevate the person's feet to increase the blood flow to the organs. Cover the person to maintain the core body temperature till emergency medical assistance is available. When dealing with any type of burn, or certain standard precaution should be considered. So these are the few precautions that you can take when you have burn injuries. Do not apply ice on the wounded area, which is the burn area, where it can cause further damage if you put this ice directly contact to the skin. Secondly, do not apply butter, ointment, or any oil-based product on the wounded area, where heat can be trapped in this area and cause further damage to the skin. Thirdly, do not pick or peel the wounded area when it is dried skin. This may cause scarring on the body and even infection to us. Last but not least, do not cough or breathe directly on the wounded area. This is because this may cause infection to the body and even other complications.
First degree burns are burns that usually only involve the top layer of skin, such as sunburns and accidentally touching a hot pot. To deal with these burns, we will first rinse the burn area under cold water. After that, we will use a plaster to wrap around the burn. Here, I'm putting a thin layer of ointment over the burn area. This ointment is petroleum jelly. Other ointments that you could use are such as aloe vera, but we are not supposed to use cream, lotion, oil, cortisone, butter, or egg whites.
Second degree burns are more serious than the first, as the damage extends beyond the top layer of the skin and usually lead to formation of blisters. So, soak the affected area in cold water for 10 to 15 minutes. Never use ice or ice water on the burn area, as it can damage the affected tissues. You can put antimicrobial ointment that is prescribed by the doctor on the skin and blisters. The name of the ointment are usually bacitracin or Silvadene. Third degree burn is referred as full thickness burn, which means this type of burn destroys the epidermis of the skin, which is the topmost layer, and also the dermis, which is the layer beneath it. You should never soak the burn in cold water. What you should do is take a clean cloth, put it over the burn, and go to the nearest hospital or clinic. The treatments used are early cleaning and debriding, which is basically the removal of dead skin and tissue of the burn area. This procedure is done either surgically or in a specialized bathtub in the hospital. Other than that, you also get intravenous fluid running through that contains electrolytes and oral antibiotics that will kill if you have any infections. You also need a warm and humid environment for your burns, and pain medications to actually cope with the pain of the burn. And if it's that severe, you also need skin grafting, which is basically taking healthy skin and to cover the burns so that they can recover. And also, if it's that bad, especially
if it's affected on your face, you need functional and cosmetic reconstruction.